So the event for today really has been the start to be able to convene a public discussion about opioid addiction. And what we're seeing is the indicators that would tell us that we're not at an epidemic issue at this point in time in Johnson County, but I think the indicators are there. And so in an effort to be proactive, we wanted to convene the community to begin to educate them and start the discussion on what we could do in Johnson County to be proactive so that we don't see the same things happen here that have been happening on the East and West Coast.
Could you talk about the new naloxone rules in Kansas?
As far the new naloxone rules, as far as you mean being able to let first responders use those, I think that is one of the most important things is when we talk about treatment. We're talking about helping people stay alive, and so that naloxone treatment allows first responders to actually administer that life-saving medication, and therefore then we can actually begin to treat the individual long-term. Before, what we dealt with was a death by overdose, and so today with expanding that availability to first responders, we really are able to save lives and get people into treatment.
The new regulation that goes into effect July 1st will basically try to increase the access to naloxone for both the lay public and both first responders, law enforcement, school nurses, etc. And one of the devices is a 4 milligram nasal spray. It's a single-use device that's very lightweight. It's got a very tiny amount of medication in there, and it basically comes like this, and you'd simply insert it in the nose and give a squirt, and it aerosolizes, and it delivers a very high dose of naloxone right to the patient. There's no sharps. It's hard to stick yourself with this, so it's very safe. But part of the regulation requires that you have training in the device that you get, that you understand signs and symptoms of opioid overdose, and also if you're a law enforcement agency, requirements to report it to a physician medical director within 24 hours, ensure that you store it appropriately, understand a proper disposal, things of that nature. So the regulation lists out several things that are required to both carry and administer it for both the public and for law enforcement.